I'm Professor Sean. Welcome to Healthcare 101. Tonight we're going to talk about insurance, or maybe better known as someone's gotta pay. As mentioned in our lecture last week, healthcare expenditures in the United States are exceeding $4.1 trillion a year. That was over 20% of the entire gross domestic product. And on average, the per capita expenditures are ranging about $11,597 per person in 2020. That actually reflects that we've been seeing a 12% increase in the average cost of care per person every year since 2000. In fact, if we break it down in a relatively simplistic way, but a little bit deeper than last time, let's split the population into two groups. The 50% that are sicker and the 50% that are less sick. Did you know that the 50% who are sicker actually use 97% of all healthcare expenditures, whereas the other 50% of the population only use 3%? What that means is, if you think of the healthier part of the population, on average, each person is costing about $747, whereas the sicker 50% on average are about $24,140. That is a lot. If you're an insurance company trying to determine your actuarials and how much risk you're going to take, that's an important thing to note, because you have a lot of risk whether or not the person you're going to insure is healthy or not. So while expenses do go up for people like you and me, it's important to note that over 72% of all healthcare expenditures are covered, paid for, by insurance companies, whereas 12% is actually falling on the shoulders of people like you and me. Now, 12% of $24,000 is a lot of money, but it's not a lot of money when you think of the healthier population when it's $747. So the risk an insurance company is always taking is not knowing whether or not the individual is the healthy person or the sick person. And therefore what they do is they end up having to distribute the cost for everybody across the entire population. And so it is fair to say that a lot of the healthy people are paying for a lot of the sicker patients who end up getting insurance. So who's providing health insurance for individuals? Well, over 51% of people in the United States receive their health insurance through their employer, whereas about 18% are getting it from Medicaid, 16% from Medicare, 8% of people still remain uninsured, which is even higher than the 6% of people who've actually gone out on the public exchange and received or gotten their own health insurance privately. 1% of people have some other arrangement. Now that we know that 72% of all healthcare expenditures are being covered by insurance companies, and that 51% of all insurance is being provided through employers, what type of health insurance plans do these employers offer? Well, 46% of all coverage is a preferred provider organization, or a PPO, whereas 28% are through high deductible health plans, 16% are health maintenance organizations, 9% are point-of-service plans, and 1% still remain fee-for-service plans. Now, those are a lot of words, and all those plans are very confusing. So what we're going to do next is we're actually going to talk a little bit about the different types of plans and explaining each one of these in a little bit of detail. Health insurance. A contract that requires your health insurer to pay some or all of your healthcare costs in exchange for a premium. Premium. The amount you pay monthly for the health insurance. Copay. A copay is a set rate for prescription, doctor visits, and other types of care. Deductible. A deductible is a set amount you pay for medical services and prescriptions before your coinsurance kicks in fully. Coinsurance. Coinsurance is the percentage of costs you pay after you've met your deductible. Out-of-network provider. Insurance company does not have a contract with this provider, therefore that provider is out of network. In my opinion, one of the more complicated aspects regarding health insurance is the terminology being used. It's definitely not consumer-friendly, especially when looking at the different names of insurance types. So what I wanted to do is provide a table which would just help compare some of the differences in terms of insurance. And what we'll be using are 5 different categories in terms of evaluating health insurance plans and discussing them. It'll be based on provider choice, that's your ability to see who you want to see when you want to see them, your access to specialist care, whether or not you're allowed to go out of network, whether or not there are going to be insurance premiums and how much those insurance premiums are going to cost you, as well as your costs, which are in addition to the premiums. These would be things like copay, coinsurance, deductibles. A fee-for-service network is one where you, as the consumer, would have access to just about any provider you want to go see, whether they were a primary care provider by choice, whether they were a specialist. You also would have access to see providers who are out of network. Now, your insurance premiums are going to be very high because of that freedom of access that you do have. And then also your costs, which means your copay, your coinsurance, and your deductibles, they're going to be quite high and the highest amongst the different plans we'll be looking at. A preferred provider organization, which you'll recall is the number one choice actually issued by employers, is one where you have some good access to providers. You have a network, you're able to pick from that network, and you can pick from an array of primary care providers. You also would have the ability to go see a specialist upon your own interest. It's just a more limited set than you had in the prior plan we discussed. Now, if you want to go out of network, which means to a doctor who is not contracted with that insurer, you are going to pay extra money for that privilege. And your insurance premiums, while not as high as a fee-for-service, are still high, and your costs are still going to be pretty high. You will have a relatively large deductible, you will have coinsurance, and in a lot of instances, you will have copays. Health maintenance organizations, or HMOs, really have gotten a bad rap over the past few decades. Did you know that health maintenance organizations are one of the few insurance types that have actually been able to demonstrate a reduction in cost and an improvement in quality for the populations they serve? It's true. So it's worth evaluating these if they're available. However, there are some limitations. In an HMO plan, you actually are quite limited to the providers you're able to pick from. And if you want to go see a specialist, in virtually all instances, you're going to need a referral from your primary care provider to go see that specialist. Now, if you want to go out of network, it's still possible, but then again, you still have to get that special authorization and referral from your primary care provider or even the plan itself. Now, the premiums are quite expensive for a health maintenance organization, and you will have decent, sizable amounts of money that you pay each month for the privilege of that plan. However, one of the most important things is that it will cost you less money on an ongoing basis. Usually there's no deductible, there's no coinsurance, but you do have a copay for just about every service you do need to receive through an HMO. Exclusive provider organizations are just what they sound like. You're pretty much limited to who you're going to be able to go see. So it's sort of like a PPO, but just with a smaller population where you'll have access to just some of the providers that are contracted with that plan. You'll have access to just some of the specialists who are contracted with that plan. But importantly, you usually will not have access to any out-of-network doctors, which means if you go see them, the entire fee will be on you. Now, premiums for these are a little bit lower because of that restriction, and your share of costs is lower than it is in a PPO, but it's still not gone. You still do have some risk, and you will have a coinsurance and a deductible, and sometimes copays as well. Now, a point of service plan I find one of the most interesting that are out there. That really is a hybrid between a PPO plan and an HMO. In a point of service plan, you actually do have access to more providers than you would in your HMO. You do, like in an HMO, require a referral to go see a specialist. However, you still can't have access to an out-of-network provider that you can determine that you want to go see. However, you will pay an additional fee to do that. Your premiums are relatively high, but in line with some of the other plans. And your share of costs is also relatively high. You will have a decent deductible, decent coinsurance, and usually some copays. This brings us to high deductible health plans. If you recall, 28% of all coverage offered by employers are of this category. This category is interesting in that if you're a healthy person, it's a quite affordable plan. Your premiums are low. However, when you do use services, your costs are going to be very high. A lot of times these are considered catastrophic insurance or coverage for an emergency. So let's say you have an unexpected hospitalization or a trip to an emergency room. That's when you finally are using your healthcare benefits and your share of costs are going to be very high. So if this is one of the plans that you have, I do expect you to take time to carefully evaluate your healthcare needs. Picking the healthcare plan that's right for you and your family is a delicate business. Quite often you'll be limited with the plans that are offered by your employer, or you'll be facing a big change, such as selecting from the Medicare plans that are available. What I do recommend is that you carefully evaluate the financial impact and the amount of risk that you can take financially when selecting a plan. Over 41% of the United States population is in debt regarding medical expenses, anywhere from $500 to $10,000. So think carefully before you select a plan, because the last thing you want to do is have bills that you're unable to pay. What's important to note when it comes to health insurance is that most healthcare plans are beginning to put more and more of the cost and burden on the consumer. The reason for doing this is because the cost is increasing at a rate that's unsustainable, but also the hope is to put a little bit of friction in the system that make you pause before getting the care that you think you need. Now, that being said, never hesitate to get the care that you need or you feel is in your best interest. But I do recommend that you do so in a very thoughtful and meaningful way, and keep in mind that your health is the most important thing to you and to your loved ones. Thanks for watching Healthcare 101. If you enjoyed tonight's show, please subscribe to the channel, and if you have any comments you'd like to share, please drop them below. If you have questions or suggestions for future episodes, please leave me a note. I'm Professor Sean. Have a great week.